How it all started was me obviously starting my course, learning the theory. I started in the back end of 2020, so we were still in COVID times. So I was doing a lot of online lectures, and I had the time to read around issues in maternity that maybe were briefly touched on in lectures or I'd seen on social media. And I realized that there were so many issues, especially for Black, Asian, and ethnic minority women and babies. And I'll be honest, before starting the course, I was ignorant to this issue. So I really felt like I was compelled to talk about the issues that I had come across on my social media platforms. And it just kind of spiraled from there. And I put on a conference in my first year called, I know, the Racial Inequalities in Maternity Services, that had a very good response. And I believe the participants learned a lot, and hopefully they've applied that into their practice. Going back to what you said earlier, Sue, about how do we manage it all, whilst theory and placement. Because we was online, I had lectures at home. So on my lunch break, I would be arranging the conference, or on my lunch break at the hospital, I'm replying to emails. It's constant. It's not, I have a day to do this. I'm doing everything. After I do my essay, I'm planning the conferences. So wow. It's a lot of work, but it's so worth it to like educate service users and midwives, students, other healthcare professionals about the issues that are going on in maternity. It's something I'm very passionate about, and I really, really do encourage students, any kind of student, I guess, nursing, midwifery, to advocate for the issues that they see and are passionate about to help really improve overall services for patients and clients.
I mean, I'm very impressed on the conference idea and how you, on earth you organise. I mean, I know you've done it in spare time. Yeah. But how did you decide on the sort of content and who would speak?
A lot of research. I did a lot of research about my speakers and what they could bring to the conference and what their message would be. So it would normally be people that I'd been following for a while, or I'd read pieces of their work if they were published. So it was a lot of research and a lot of time. Creating the conferences also took a lot of time, and the bits that I was speaking about, I had to go back and research and get my references and make sure I was speaking up to date about the issues that I'm talking about. So it was kind of like doing a separate theory piece of work, really. But it was manageable, and because I was passionate about it, it didn't seem like work. It didn't seem like a chore.
Okay. So how about in clinical practice? How do you bring those skills into your role as a student in clinical practice? Because that's quite a big task.
It is a big task, and it's not easy. It's scary, especially as a student. Obviously, you're still learning. Your knowledge is increasing. You're not up to the qualified standards in knowledge. So if you are seeing something and you want to kind of, ask, is this the right way to go? Or you really feel like this isn't right, you have to make sure that what you're saying is clear and concise, and what your point is, to make sure it's heard correctly, and use your support systems to help you through that process, whether that's at uni or your clinical supervisors in placement, your friends, your family, other students, because it's important to use your voice. Part of being a midwife or a nurse is being able to advocate for your patients and your clients. So you need to be able to make sure that you can do that effectively in the right way, in an appropriate way, to make sure that you get the correct response. That's not always guaranteed, because it depends how people receive that, but you just need to be strong in what you believe and know that you're fighting for the right reason. And also advocate for yourself. If you're not having a good time in placement, really don't just brush it under the carpet. You need to address that the best way you can with the help of your university.
That's probably harder actually than advocating for women, isn't it? For yourself, because it's kind of easier fighting for someone else, isn't it?
I think, I don't know actually. I guess they're harder in different ways. Because if you're advocating for a client, you can kind of detach in some ways emotionally yourself.
Yeah,
but if it's about yourself, it's consuming.
Yes.
So it's hard, and then it's hard to get your point across the way that you want to. But I would really advise anyone that's having any problems to definitely use their voice and advocate for themselves, because it could actually improve the experience for other students also.
So what was the biggest challenge, do you think, Amber?
The biggest challenge? I think learning to use my voice.
Okay.
It was hard because I'm a student, and I always had that fear of people saying, well, she's just a student. She's in her first year or her second year. What does she really know? She hasn't worked in clinical practice full time properly as a qualified midwife. She hasn't really seen much. But that's not the right approach to take. I've read the research, I've read the statistics, I've heard other people's personal stories. I know that issues are out there and they're real. Whether I've seen them not personally is irrelevant. They're still there. So it's really important to just make sure that your voice and your point is being heard and contribute to creating a change and making a better service for everybody.
Okay. So, I mean, how would you, just to give that for that student on her first day or maybe second day in the clinical area?
What advice would I give?
Yeah, let's have a bit of advice. You're in your third year, you're coming to the end, you're going to be blossoming forth as a midwife, which is wonderful.
Thank you. The advice I would give is to learn as much as you can from all the different midwives you'll work with, because every midwife would work differently with the same tools. So you might like one midwife style of working compared to another. So really absorb that. Be proactive. Don't shy away from doing the skills. Watch how it's done. Read the theory. Go and practice it if you can. And just take any opportunity of learning that you can to really build up your skills and your knowledge. Go home after a shift. Read about something interesting that you've seen on your shift. Read the guidelines. Read the evidence, and just increase your theory outside of what your uni is providing you to really enhance your knowledge for when you do qualify at the end of the course.
Yeah, so I was interested. You said you were saying right at the beginning that people had briefly touched on areas. I'm taking you meant inequalities and racism or whatever. Mm-hmm. Is that still happening, that not much is mentioned? Or do you think I suppose what I'm trying to find out, if one, how much was included in your program, but also whether that's changed as an effect of you being there. Do you think it has?
I personally, I don't think it's changed because of me. My program, again, I can only speak for my program. I'm not sure.
Yeah, of course.
But my program has been very good at addressing inequalities in maternity care and educating students on how to not bring unconscious bias into your practice and making sure it's an inclusive service. So London South Bank have done a really great job at doing that, and that is actually off the own back of their own research and adjustment of the curriculum to go with current times and to address the issues that have in maternity services. So I do believe that the students in my university should, when they qualify, be aware of the issues and how to break down any personal unconscious bias so it doesn't affect the care that they're giving.
Yeah, because that's really important. That's an important focus. Yeah. But do you think they put more in since you started, more of that sort of content?
So I believe that the cohort, the first years now, they have a different curriculum, and I think at second years too, I think there is more of a focus on racial disparities and other inequalities in their program, so that those years will have a better understanding.
Yeah. Oh, that's grand.
Doing a really good job.
Yeah. Really, I think they need to wheel you in to be doing some of the sharing of how you can cascade it down.
Yeah.
I was wondering if you had any challenges with women, or women who just might have said to you, oh, well, I'll just do as people want. Have you had when you've tried to I guess what I'm asking is, when you've advocated for women, have there been times when it's been difficult because the women almost haven't wanted to be advocated for?
I think you have to read the room about, and treat it on an individual basis, and what's the vibe of the women and her birthing people and their families. For any woman, I always advocate that, excuse me, it's your body, your baby, your choice. Always ask for the risks and benefits of any intervention or treatment offered to you, so you can make an informed decision for yourself.
Yeah. So that's been fairly straightforward then.
I mean,
that's it.
It's not always straightforward, but you just have to keep persevering and let them know that not everything that is offered to them is they have to undertake.
Yeah, no, and that's a key part of it. But it is difficult, isn't it, to sort of have all that statistics and all that research knowledge that you can share with women so easily. I guess you're obviously a very avid reader with lots
I do like it. Well, do not have time to read for leisure.
Yes. But don't throw away the textbooks, because I think what you were saying, even to students, as when they get home, reading something that's come up in practice, that's a really good thing to do as a qualified midwife, isn't it? It sort of just refreshes the brain and the parts that need to be reached. I mean, I love the sort of graphic on your thing. The voice is powerful, because that comes over as very confident. And do you think yourself a confident, or did you think you were confident when you started?
When I started, I wasn't confident, actually. And sometimes I have days where I'm like, oh my gosh, what am I doing? But you have to push through for the greater cause. And I'm passionate about what I'm saying and what I'm doing.
Yeah.
So I feel like that drives me to keep going. And to be honest, being acknowledged by the Nursing Times and winning the award helped me really be like, wow, actually people are listening to me, and they actually are interested in what I have to say. So I think that spurred me on. And during my third year, I've taken a bit of a break with the conferences for various reasons, but once I qualify, I'll be back doing my own conferences, and I really want to spread awareness about different issues that are still going. So I feel like I've got a good plan for where I'm going to go with it.
Fantastic. That is superb, Amber. I'm really pleased. It's been really nice you sharing your journey, or part of your journey, because I know that it's quite a short time that we will give you to talk about it. But I will really commend our audience to read. It's all online, very, very easy to access. And if you have any questions for Amber, for those of you watching, just pop them in the chat box. They'll come through to me, and I'm just reminding you, because I'm going to look away over here, they'll come through to my other screen, so I can ask Amber at the end of the session. So we should have time for questions. But thank you so much, Amber. And I think a worthy winner of the award, and it's so lovely that you were able to come with us and share your journey. And congratulations.
I know, thank you.
Fantastic.
Thank you.